Take a mental health break with the Mood Disorders Association of Manitoba and U Radio.
My name's Dr. Kirsten Reynolds, and I'm a clinical psychologist and associate professor at the University of Manitoba in the psychology department. And I am collaborating with Rita and Mood Disorders Association of Manitoba in this important project funded by Children's Hospital Research Institute of Manitoba and Prime, which is focused on co-developing an important initiative for pregnant and postpartum people who are struggling with their mood, with depressive symptoms.
So Rita, how did MDAM get involved in this initiative? Did you have this idea? How did it all come to fruition?
Well, first of all, thank you for the opportunity to talk about this great project that we're very excited about. And it's a pleasure working with you, Dr. Reynolds. I'm really looking forward to it, and thank you for taking on this project and helping us lead it. So to answer your question, we've had our women's program for many years. It is in hiatus right now, and I'll be very frank about it, that it was primarily due to funding restrictions. However, we're hoping that will come back. But what we found in the women's program was one of the most common areas that women were reaching out to us was around postpartum depression. They wanted information. Many of them were experiencing postpartum depression, and not just the women, but it was also their partners. It was their families that wanted to know how to. So this was a great opportunity when the opportunity through Prime came up for us to apply for research. We felt this would be a good subject matter for us to consider, and we got into. Dr. Reynolds was on doing similar research and invited us to consider working together, and we accepted and we submitted a joint proposal. So here we are, and I'm so glad we're talking about it on air.
So, Dr. Reynolds, for postpartum depression and this project as a whole, what sort of questions are you going to be asking and looking at as you're working with MDAM?
Yeah, great question. So really, we're hoping to first start by collaborating in developing a program that can be offered through Mood Disorders Association of Manitoba that would provide people who are pregnant and postpartum, who are experiencing depression, with services that they need at that time. And from there, we really want to bring science into understanding. Is this program working? Is this program helping to alleviate symptoms of depression, anxiety, helping to bring people closer together and help with social connection? And how is the program working so that in future offerings we can continue to improve and refine the program? And I think largely what we hope to show is that, like other studies that have been done in other countries, peer support is extremely effective in managing symptoms of perinatal mental health.
Peer support. I know MDAM peer support is kind of
that is our model.
It's your model. It's the cornerstone of what you do. And from these reports, finding that it goes a long way. Why is peer support, and this is for both of you, is an effective tool?
Well, I'll start, and I guess I can start from a very personal lived experience, and also a bit of bringing my cultural background and into it, and my understanding of how that works well. I belong to the East Indian culture. I mean, that's what my original. I'm originally from India, so although postpartum is not talked about as openly in many cultures, it still exists. However, the way women who are supported by families after birth is a very integral part of the reasons, I think, why people don't talk about it. They don't even recognize that it can happen. And so one of them is the family support system, the peer support system from families, being able to be there, the mother-in-laws, the moms, the sisters, the aunts, And in the Indian culture, there's actually 40 days after giving birth that the new mom is really taken well care of. She's fed, she has help with all of the things that, new moms need. She basically gets to rest and do a lot of things. So I think part of that has incorporated into why it's not seen as an actual concern, because there's all this support.
So there's already that community support in place.
In place, yeah. And, I didn't even realize that I went through postpartum after all three of my deliveries. But now I realize that that's what I was experiencing. It's the hormonal piece that people don't often, understand. They think it's just the support, but there's the hormonal piece that has to be understood and recognized. I know, Dr. Reynolds, if you have a comment on that aspect of it.
There's so many reasons as to why peer support is a really important model around lots of different mental health concerns, but especially perinatal mental health concerns. And one reason is access to treatment, that it can be hard to find a psychologist or a professional who has time in their schedule, who has availability to meet with people. Another is stigma, in terms of sometimes people feeling some stigma to go to see a mental health professional or a health provider to talk about their mental health. And a third is that peers just get the experience. And so talking to a peer who has gone through an experience with mental health in the pregnancy and postpartum period, as well as learning from that peer of evidence-based, effective ways to cope through problems, just really brings together the evidence and effective mental health strategies with a listening ear who's been there, who can understand what one's going through, and who can help people to process their experiences and move forward in a way that's going to be good for them and good for their little ones too, good for their growing fetus and or their infant as they're developing.
So I know this conversation has developed a lot over the years. You use please correct me if I get this wrong. Perinatal mental health, is that the term that you're using there?
Yeah.
Okay, perfect. For that, just that term in itself has changed, from postpartum depression. There's, as you go back far enough, they talk about mania and things like that. When it comes to perinatal mental health, how do you feel the conversation has evolved over the decades now that we're here in 2026? Or maybe even just through your professional career and experience, how do you feel it has evolved?
Yeah, I think it's definitely evolving. And I think people are talking more and more about stress in pregnancy and stress in postpartum and anxiety and depression. People are having more open conversations about that, which is great. And for some, seeking help can be the very first time where they've spoken about their mental health. And so I think while the conversation is evolving, it still hasn't evolved yet to a place where people are openly talking about their mental health, readily getting the help and support that they need, which I think is one of the reasons why this collaboration and why Mood Disorders leading this work is so important, because it can, Mood Disorders is a feature organization in the community that has a long-standing reputation of providing such great service. So the fact that there's going to be a program within Mood Disorders that can really respond to depression and mood-related concerns in pregnant and postpartum people is just one step further to sort of broadening accessibility and furthering this important conversation around the really prevalent rates of stress, anxiety, and depression in pregnancy and postpartum.
And for me, again, I'll speak from my lived experience. I know that I experienced it. I just didn't recognize it or even think about it. I didn't even have a title for it. I didn't even have a name for it. But I know that each time that I experienced it, I did get support, whether it was mostly from my family, and my husband, who was just wonderful to help take him. In fact, I think he was a better mom than I was in many ways. as I learned more about mental health, as I got into this space at Mood Disorders, I recognized that not only had I experienced it, but my mother had too. I think for me, this became very much a personal need to educate others, not just to educate, but to really provide that support that's needed, and to have, a better understanding of why we go through this, that it's not something to be shamed about, it's not something that you've done wrong, and it's not your fault, it's not your baby's fault. It's really about that understanding and working towards getting well and taking care of your loved one.
Now, this project is helping fill a lot of gaps that we're seeing within the mental health sector here in Manitoba. We're exploring perinatal mental health. When we're going through this program to providing supports for individuals, what sort of approach will you be applying for, not just cis women, but for, BIPOC, minority communities, particularly when it comes to the aspect of to us LGBTQ plus individuals, someone who's trans and had a baby and going through this. So what is going to be that approach when encompassing and providing supports for minority communities?
Absolutely. Great question. And I think both of us can respond to that. I think we're very much in the planning stages at this point. We're thinking, we have an outline, what we have submitted for approval, and that's what the grant was based on. But the details have to now be worked out. Absolutely, we recognize the importance of providing information to all of the folks that are involved in parenting. It doesn't matter what community they come from. It's parents in general. So absolutely, we will ensure that we look at a very diverse population, and the folks that we connect with, the ones that we incorporate into our focus groups and other activities that we intend to have, that is part and parcel of our planning. Dr. Reynolds, you want to add more to the research component of it?
Yeah, absolutely. I mean, I think that'll be a really important part of our planning and co-development will be to focus on co-developing a service or program that's not only acceptable, but that's inclusive and that's going to provide a welcoming space to people who are managing depression during their pregnancy and postpartum experience, whomever those people might be, and so definitely we'll be paying close attention to elements of inclusivity and equity and diversity throughout our planning and development, as well as talking with people after they participate to gain a sense of how accepted did people feel, how did people experience the group, and did they feel a sense of belonging? So I think there's a lot of room for some qualitative understandings of people's experiences, as well as some quantitative questions to understand that aspect of did people feel safe in sharing and disclosing their experiences throughout the eventual program that we develop together.
One of the things that we've noticed in the last few years when we've dealt with families that are new parents particularly, is that the partners are equally involved in that sharing those responsibilities. I mean, I think we still have a long way to go, but it's starting to transition, which is very encouraging. And we want to continue that messaging, that it's important, not everything is left only to the new mom, but also it's the partners in raising a new life and a new child from beginning to end, that they are to be equally involved and take care of one another. I think some of the stories that have come out in recent years where there has been incidents where people have, through postpartum depression, there have been a loss of life, it was the families and the partners that wanted to do something about it. And they're the ones who, inspired us to say, we need more information. We need to get this information out, not just to the mother giving the birth, but to the whole family.
So right now we're in those very early stages of development. What's kind of the rough timeline that we're looking at once this project and everything starts getting underway?
Well, the grant that we have is officially starts, I believe, on April 2026, and I believe we have a year to complete the project. So we'll be meeting, I think, to start planning out the timelines and things like that, to see how it's going to work, and organizing all the activities, follow up, the evaluation, all of those pieces that go into a good research project. I think that research is such an integral part of this type of work and this type of need that exists in the community, and that's why the collaboration with the University of Manitoba is very integral and important for us as an organization, to have that empirical information, to have that the scientific background that's needed to share with others.
And then for you, Dr. Reynolds, as we eventually hit into this project, hopefully in the next couple of months, what are some things that maybe you're hoping to see as people start coming through this program?
I hope that we can promote the program. I hope it's a program that people can come to and feel like they can open up. And my goals would be that we create something that is accessible and inclusive and sustainable, that can be offered in a regular way, with time over many years. And in terms of the data, I hope we can show something that show some data that this is helpful in reducing symptoms of depression and perhaps other common mental health experiences like anxiety and stress as well, and that it's boosting people's maternal self-efficacy, or the ways that they feel about their ability to parent is often quite impacted. When we feel depressed, we feel like we're that some of this kind of worthlessness can seep in. So I also hope that we can not only create change in symptoms of depression, but also changes in how people feel in terms of their attachment to their growing little one, as well as how they're parenting, and maybe some of those social connections more broadly. So I hope we can create something that can make an impact and that's sustainable over time.
Dr. Reynolds, Rita, thank you so much for taking this time to talk with me. I'm going to be very interested to seeing how things go through this program, maybe come to the end of it. And, it'll be interesting to see over the coming years how the literature and what you've seen and noticed here helps influence and changes our strategies approaching mental health.
Well, thank you for the invitation and always having these great conversations, Ryan. You invite us to such incredible topics that you showcase on your channel. But for sure, we will be very much updating you on how things progress. We'd love to do a second round of this. Maybe 6 months down the road to see where things are in the process, and at the end of the project, and hopefully we'll continue after that. But thank you for recognizing the importance of this work.
That would be great. Thanks so much for the invitation to be here. And Rita, thanks so much for this amazing opportunity and collaboration to make a real impact in Manitoba.
Thank you for taking a mental health break with the Mood Disorders Association of Manitoba and U Radio. I'm Ryan Funk, and take care.